Go. Hi, Eileen, Veilleux the fam here. Welcome to a new installment in our mini mental health series. And in this new one, we are going to be covering intermittent exposure disorder. Before we begin, just a reminder, there will be three keywords throughout this video. I will let you know what the keyword is by saying keyword and then stating that keyword. So at the end of the video, in the comment section, put down what the three keywords are to be entered into my merch giveaway for when I reach 2,000 subs. Okay, so saying that, let's get started with today's lesson. Intermittent explosive disorder. Intermittent explosive disorder involves keyword repeated sudden episodes of impulsive, aggressive, violent behavior or angry verbal outbursts in which you react grossly out of proportion to the situation. Road rage, domestic abuse, throwing or breaking objects, or other temper tantrums may be signs of intermittent explosive disorder. These intermittent explosive disorders cause you significant distress, negatively impact your relationships, work, and school, and they can have legal and financial consequences. Now, intermittent exposure disorder is a chronic disorder that can continue for years. Although the severity of outbursts may decrease with age, treatment involves medications and psychotherapy to help you control your aggressive impulses. Some of the symptoms of explosive eruptions occur suddenly, with no little warning, and usually last less than 30 minutes. These episodes may occur frequently or be separated by weeks or months of non-aggression. Less severe verbal outbursts may occur in between episodes of physical aggression. You may be irritable, impulsive, aggressive, or chronically angry most of the time. Aggressive episodes may be preceded or accompanied by some of these different things: rage, irritability, increased energy, racing thoughts, tingling, tremors, palpitations, chest tightness. The explosive verbal and behavioral outbursts are out of proportion to the situation with no thought to consequences and can include, I had to swallow, temper tantrums, tirades, heated arguments, shouting, slapping, shoving, or pushing, physical fights, property damage, threatening or assaulting people or animals. You may feel a sense of relief and tiredness after the episode. Later, you may feel remorse, regret, or embarrassment. If you recognize your own behavior in the description of intermittent exposure disorder, please, we implore you, talk with your doctor about treatment options or ask for a referral to a mental health professional. Some causes of intermittent exposure disorder can be keyword childhood, after the age of 6 years, or during the teenage years. It's more common in younger adults than in older adults. The exact cause of the disorder is unknown, but it's probably caused by a number of environmental and biological factors. The environmental factor: most people with this disorder grew up in families where explosive behavior and verbal and physical abuse were common. Being exposed to this type of violence at an early age makes it more likely these children will exhibit the same traits as they mature. Genetics: there may be a genetic component causing this disorder to be passed down from parents to children. And and differences in how the brain works. There may be differences in the structure, function, and chemistry of the brain in people with with intermittent exposure disorder compared to people who don't have the disorder. The risk factors involved for developing intermittent explosive disorder: history of physical abuse. People who were abused as children or experienced multiple traumatic events have an increased risk of intermittent explosive disorder. History of other mental health disorders. People who have antisocial personality disorder, borderline personality disorder, or other disorders that include disruptive behaviors such as attention deficit hyperactivity disorder, better known as ADHD, have an increased risk of also having intermittent exposure disorder. The complications involved with it is impaired interpersonal relationships. They're often perceived by others as always being angry. They may have frequent verbal fights, or there can be physical abuse. These actions lead to relationship problems, divorce, and family stress. Trouble at work, home, or school. Other complications of intermittent exposure disorder may include job loss, school suspension, car accidents, financial problems, or trouble with the law. Problems with mood. Mood disorders such as depression and anxiety often occur with intermittent explosive disorder. Problems with alcohol and other substance abuse. Problems with drugs or alcohol often occur along with intermittent explosive disorder. Some physical health problems, medical conditions are much more common and can include, for an example, high blood pressure, diabetes, heart disease, stroke,